The P500 Therapy Surface is a weight-based pressure redistribution surface with advanced microclimate technology. The P500 Therapy Surface is designed to be a safe surface and easy to use to effectively treat your patients, managing care for safe skin and patient comfort by helping prevent and treat stage 1 through 4 pressure ulcers. This presentation will cover the features of the P500 Therapy Surface. In addition, we will demonstrate the air control box, along with several key aspects to enhance the operation of the P500 Therapy Surface to better meet the needs of your patient. The surface is a weight-based pressure redistribution surface with a therapeutic weight limit of up to 500 pounds. Remove the P500 Therapy Surface from the box and place it on the frame. Release the straps and roll out the surface with the hose fitting towards the foot end of the frame. Use the straps and firmly attach them only to the sleep deck on the frame. The straps can be configured in a variety of ways to facilitate various models of frames. Make sure the straps are through the sleep deck only. Failure to do so could cause the bed to not articulate as intended, which might result in injury or equipment damage. Next, remove the air control box from its shipping container, where you will also find the power cord, air hose, and support strap. Use the handles on the side of the air control box to carry it to the bed. Pull the hangers out from the unit to the applicable width. Turn the hanger hooks until the arrows on the brackets align. Adjust the height to the appropriate extension length. Turn the hangers approximately 90 degrees toward the bed to lock them into the correct position. Next, connect the air hose to the surface and to the air control box. The ends are interchangeable, and you can hear a click when it locks firmly into place. Loose hose connections will cause errors. Use the hose support strap to support the hose to keep it from slipping to the floor. Simply wrap the strap around the hose and connect it to the hook on the bottom of the air control box. Finally, connect the power cord and position it out of the way to prevent any accidents. The surface is divided into 3 pressure zones: the head, the seat, and the foot. Hillrom utilizes advanced microclimate technology to produce the next generation low air loss surface. The air flows under the surface of the body at 46 liters per minute to help maintain skin temperature between 90 and 95.5 degrees Fahrenheit. This airflow helps keep the skin cool, dry, and comfortable. The Hillrom P500 Therapy Surface makes use of Nano AG Plus technology as part of the surface. Silver particles are embedded into the ticking to kill 99.9% of stain and odor-causing bacteria on the P500 Therapy Surface. The surface includes the built-in X-ray cassette sleeve, which is accessible on each side of the head portion of the surface. The sleeve makes it easier for a caregiver to insert an X-ray cassette, allowing for closer placement to the patient. This sleeve was designed to help reduce patient and caregiver injury during portable X-ray procedures. Next, we will explore the controls on the air control box. With the air control box properly in place and connected, we can flip up the display screen and turn on the power. The controls are grouped into 3 separate areas. The upper portion adjusts the surface in terms of comfort settings. Normal mode is used for optimal pressure and redistribution. Max inflate causes the surface to firm for repositioning activities. The patient weight setting allows the caregiver to enter the patient weight using the plus and minus keys to set optimal pressure redistribution. Note that the patient's weight must be entered within 5 minutes of setting up for the new patient, or the alarm will sound to prevent using the last patient's weight setting. Weight settings can be displayed in pounds or kilograms by pressing the pound-kilogram key. The lockout key will lock out all controls on the panel. This provides an additional level of safety. The message center displays surface functions and service modes. The comfort settings allow the caregiver to adjust up or down individually the head section, seat, and heel sections to improve the patient comfort level for the individual patient's preferences. The lower left section has 3 buttons for enabling turn assist. Either the turn assist left or right button can be selected to reposition the immobile patient, reducing possible caregiver injuries. A warning light will flash to indicate you have confirmed that the side rails are up. Press the button when you have confirmed the side rails are up. The lower right section has several buttons that provide for the alarm settings. On the top is the silence button to mute the alarm buttons. Volume is adjusted to one of 3 possible volume settings. The default alarm volume is set on high, but can be adjusted as needed. The next button is the out-of-bed alarm, which will trigger when the patient tries to exit the bed. The caregiver can then come to the assistance of the patient when alerted to the patient's activity. The middle button is the 30-degree head-of-bed elevation button. The light bar will flash orange to indicate if the head of bed has been lowered below the 30-degree mark when this feature is activated. An audible alarm will sound after 5 minutes. The Remind Me Settings button is used to alarm various intervals for routine patient care tasks. Alarms can be set in 30-minute increments for up to 4-hour intervals. To transport a patient on a frame with a P500 Therapy Surface, please follow these instructions, which can also be found in the user manual. First, make sure the control unit is installed on the bed footboard, and use caution to prevent it from disengaging or falling off of the footboard. Follow the specifications and manufacturer's guidelines for weight restrictions and operation of the bed frame. During transport, keep the bed's foot section as flat as possible. Take care to prevent contact between the air control box and the floor, inclines, or objects on the floor. Make sure the control unit does not hit walls, doors, elevators, or other objects which may cause damage to the unit in any way. The process to transport begins with turning the power switch off and disconnecting the control unit from the power source. Close the display panel on the control unit. Put the bed into transportation position. If the control unit and hose are to remain in the room, press the disconnect switch on the hose assembly. Remove the control unit and place the air control box, hose, and power cord in a safe place away from traffic. Transport the patient on the bed as necessary. When the transport is complete, reinstall the control unit and hose assembly, connecting it to the surface. Then connect the unit to an applicable power source and proceed to set up the system for occupant placement. Cleaning the P500 Therapy Surface is recommended between patients and at regular intervals during extended stays. Always disinfect Hillrom surfaces thoroughly after each use according to facility and healthcare protocol. We recommend that you clean the unit with detergent and warm water. Do not use excessive liquid or harsh cleaners. Do not use steam cleaning devices on this unit. When cleaning the control unit, use a damp cloth to clean. Make sure not to soak it or spray the control unit with liquids. Refer to the user's manual for additional cleaning information. To deflate and remove the P500 Therapy Surface for storage or transportation, first, evenly distribute 100 pounds or 45 kilograms of weight on the surface. Next, enter the service mode by holding the lockout button for approximately 10 seconds. Once in service mode, use the plus or minus buttons to maneuver to the appropriate menu. Use the pound-kilogram control to select an item. To exit service mode, hold the lockout button again for approximately 10 seconds. In service mode, select Deflate Mattress, then Yes to accept the choice. The display will indicate the level of deflation for each section. When the surface is deflated enough, exit and turn off the unit. Remove any weight from the surface and close the display. Unplug the power cord and secure it with the control unit. Disconnect the hose from the surface and the control unit. Clean the unit thoroughly as described in the Clean and Disinfect section, along with any additional facility guidelines. Set the hose and control unit away from the surface. Once the surface is completely dry, fold the surface into 3, starting with the head end of the surface. Then bring up the foot end and connect the straps to keep the surface folded. Put the surface in a plastic bag. Rental units would then place this plastic bag into the fabric bag. To transport the surface, use the handhold positions to put the surface either on a bed frame, in a transport bag, or on a cart. The P500 Therapy Surface should be stored in a safe place within the recommended environmental conditions.